Hello, good morning to all of my dear viewers. Now I am going to discuss a very important topic of the community medicine, and the name of topic is the management of tuberculosis. So really this topic is very important. So without any delay I am going to start the topics. We start the topic with susceptible TB. What there are two types of TB now. One is the drug resistance TB and other is the drug sensitive TB. So we first start the treatment of drugs sensitive TB. Okay, so first we start the treatment of drugs sensitive TB, I mean tuberculosis. So in drugs sensitive, not only in case of the drugs sensitive TB, overall the treatment of the TB it takes a 6 month duration. The TB treatment duration is how many days? It is a 6 month. So in 6 month TB treatment duration, we divide this 6 month into the two phases. One is the initial 2 month and the later 6 month. The initial 2 month of the treatment it is called intensive phase. Initial 2 month is called intensive phase, and the later 4 month is called continuation phase. Continuation phases. So why we called initial 2 month as a intensive phase? Because in the initial 2 month now we give more number of drugs for the rapidly killings of this tuberculosis bacteria. So that's why we call it is a intensive phase, because in this phase we more rapidly killing the tuberculosis bacteria. Okay, so after discussing about this intensive phase and the continuation phases, now we are write the name of drugs which are given in intensive phases. So in intensive phases we basically gives 4 drugs. In intensive phase we give 4 drugs. What are the name of these drugs? The first drugs is the isoniazid. Isoniazid with a doses of 5 milligram per kg. Okay, what are the second drugs? The second drugs is the rifampicin with a dose of 10 milligram per kg. The third drugs is ethambutol. The third drugs is the ethambutol with a dose of 15 milligram per kg. And the fourth drugs is the pyrazinamide. Okay, pyrazinamide with a dose of 25 milligram per kg. Okay, so these are basically the 4 drugs we are given in the intensive phase of tuberculosis treatments. Okay, so what happens? We can't give. There are 4 separate drugs to the TB patient. We combine these all drugs. In a single tablets. So when we combine more than 2 drugs in a single tablets, then it is called fixed dose combination. It is called fixed dose combination. So what is the meaning of this fixed dose combination? Whenever we combine more than 2 drugs in a single tablets, it is called fixed dose combination. So in TB treatments, we not give 4 different drugs. We combine all these drugs in a single tablets which is called as fixed dose combination, and we give this fixed dose combination to TB patient. So how many tablets of fixed dose combination we give TB patient? It is depends on the weight of TB patient. For example, if a patient weight is lies between 25 to 34 kg, in this condition we give two tablets. In this condition we give two tablets of fixed dose combination. Okay, if the weight is lies between 35 to the 50 kg, in that condition we give three tablets. Okay, and if the weight is lies between the 50 kg to 64 kg, then 4 tablets. And if his weight is more than 65 kg, in that condition we give 5 tablets. So these are basically the fixed dose combination tablets that you give in a TB patient. This weight criteria is applicable both in case of continuation phases and in intensive phases. So how many drugs given in the continuation phases? In intensive phases we give 4 drugs. How many drugs given in case of continuation phases? In continuation phases, basically most of the bacteria are already killed in this intensive phases, so there are less overloads of bacteria in the continuation phases. That's why we reduce the number of drugs. According to the WHO, they prefer only 2 drugs. One is isoniazid and another is rifampicin. But in India, according to National TB Elimination Program, we prefer 3 drugs. So, there are 3 drugs. One is isoniazid. One is obviously the isoniazid. Another is rifampicin, and the third drug is ethambutol, So according to the National TB Elimination Program, we prefer 3 drugs, but when we go for the WHO, they prefer only 2 drugs. They not prefer ethambutol. But India, we prefer ethambutol. I mean, we include ethambutol because according to the bactericidals, there are one more drugs which are bacteriostatic in nature. Basically, this ethambutol are the bacteriostatic in nature. So we go for the 3 drugs. These 3 drugs are also combined in a fixed dose combination, and the number of tablets of fixed dose combination given according to this weights. So these are overall the management of the TB patient who are drug sensitive. Now after the management of this drug sensitive TB patient, we go for the drugs resistance TB management. Okay, so first I erase my blackboard, so that's why I write on it. Okay, it's fine, go quickly. So after discussion the drug sensitive TB, now we go for drug resistance TB. We go for the drug resistance TB. So in drug resistance TB, we classify it into the 3 categories. One is the single drug resistance, and the second is multiple drug resistance, single drug resistance, multiple drug resistance, and the third is extremely drug resistance, Okay, so first, what is the meaning of this single drug resistance? Single drug resistance means patient having a drug resistance of only one drug, Normally, patient having a drug resistance of either isoniazid or the rifampicin. So what we do if a patient having a isoniazid resistance? What are our treatment approach if a patient having a isoniazid resistance approach? In that condition, we give three drugs. One is the obviously rifampicin, and the remaining two are one of the ethambutols, and the third is obviously pyrazinamide. So we go for these three drugs for how many days? For 6 months. Now in case of the drug sensitive TB, now there are 4 drugs in initial 2 days, I mean 2 months, and the remaining 4 months we give 3 drugs. But in case of resistance TB and especially this isoniazid resistance, we go for 3 drugs for all 6 months. So but problem is that in market this combination is not available. Now in market this combination is not available. In market having a combination of this HRJD, I mean isoniazid resistance, pyrazinamide and ethambutols. Then what we do? Obviously we go for this HRJD combination for 6 months. Now someone start questioning to me, why we give this isoniazid if a patient having already resistance to the isoniazid? Because in market there is no these 3 different drugs combination is available. In market there is a combination of HRJD, so in spite a patient having a isoniazid resistance, we prefer HRJD combination. Okay, so this all about a patient having a isoniazid resistance. Now what happens if a patient having a rifampicin resistance? What happens if patient having rifampicin resistance? So in case of rifampicin resistance, now we follow the criteria of multiple drug resistance treatments. So now we are going to see how we what are our approach in case of multiple drug resistance tuberculosis. What our approach in case of multiple drug resistance TB, I mean the second point, multiple drug resistance TB. So in first we try to understand what is the meaning of this multiple drug resistance TB. Multiple drug resistance TB means patient having resistance of at least 2 drugs. Patient having drug resistance of at least 2 drugs, and this at least 2 drugs, the 2 common drugs is the isoniazid or rifampicin. So if a patient having a combination of this isoniazid or rifampicin resistance, or either patient having a rifampicin resistance, in both cases the treatment approach is same. So what are the treatment approach? We go for a B-PALM regimens. So what is the different drugs which comes under this B-PALM regimens? B stands for the bedaquiline. Okay, and the P stands for pretomanid. B stands for pretomanid, and L stands for linezolid, and this M stands for moxifloxacin. So these are the basically they are the second line drugs that we give in case of multiple drug resistance, or if a patient having the rifampicin resistance. One of the common drugs is the bedaquiline, retomanid, linezolid, and the moxifloxacin. Okay, one. So these are after discussing this multiple resistance TB. Now we go for extremely drug resistance TB. Wait for 1 minute. Okay, it's fine. So now extremely drug resistant. What happens in case of the extremely drug resistance TB? Extremely drug resistance TB. In extremely drug resistance TB, here patient having a multi drug resistance. I mean a patient all having a resistance of isoniazid and the rifampicin. Along with they also having a resistance of the fluoroquinolones means they are a resistance of either amoxicloxacin or levofloxacin. One more things I forget to mention. In case of multiple resistance TB, along with that not in case of multiple resistance TB, sorry, in case of single dose I say that we give no HRZE combination. So along with HRZE combination we also add levofloxacin. So this levofloxacin, I forget to tell about this levofloxacin. I am really sorry. So in single dose combination along with HRZE combination, we also gives levofloxacin. Okay, so that's fine. Now in case of the extremely drug resistance TB, our treatment approach is first the drug. I mean, what is the meaning of this extremely drug resistance TB? Patient having a multiple drug resistance, I mean they having a resistance of isoniazid and the rifampicins, and along with they having a resistance of what this fluoroquinolones. I mean include them amoxicloxacins and the levofloxacins. So what was the approach of treatment in that condition? In that condition, we use the second line drugs like bedaquilins, and also we use the retomanid, amikacin, clindamycin. So these are the second line drugs like bedaquiline, protomanid, amikacin, clindamycin we are given for extremely drug resistance TB. So overall these are the management approach of TB who having a drug resistance, and some of them the drug sensitive TB. So finally the lecture is over. That's all for today. Good night.